Good evening and welcome, everyone. We're going to give it just another minute and then we'll get started with our program. Good evening and welcome. My name is Anna Marie Golden. I'm Director of Community Relations at Baystate Health. On behalf of Baystate Health, I thank you for taking time to join us this evening for our COVID vaccine town hall. It is my pleasure to serve as your host and moderator. Baystate is hosting tonight's town hall because we understand that pregnant individuals and individuals trying to get pregnant or anticipate being pregnant have questions and concerns about COVID and the vaccines. Our goal this evening is to provide you science and fact-based information and answer your questions to the best of our ability so you can make an informed decision. First, a few housekeeping items to ensure that everyone's participation goes smoothly. We have participants joining us this evening via Zoom, by phone, and others who are streaming via Facebook or YouTube. Please note we are also recording this town hall, so it will be available for on-demand viewing on Baystate's YouTube channel. We will be providing closed captions, and these will be automatically streamed to our participants joining by Facebook and YouTube. For those joining us via Zoom, to turn the closed captions on, please click the closed captions icon in the bottom of your screen. I'd like to take a brief moment to offer my appreciation to Baystate's marketing and communications team, Baystate's translation services, our presenters, and finally, our community partner, Focus Springfield, for their invaluable technical expertise in producing this evening's event. We will be hearing momentarily from our presenters. Following from the presentation, I will open the program for questions and answers. For those joining us via Zoom, please look to the bottom middle of your screen where you will see the Q&A icon. If you would like to ask a question during the Q&A portion, please submit your question via the Q&A icon. I will share the first name of the person submitting and their question in the order they are received. If you would like to remain anonymous, please check anonymous when submitting your question. We have also invited the community to submit questions in advance. As time allows, these questions will be incorporated into the Q&A. It is now my pleasure to introduce you to our presenters. We are joined this evening by Dr. Lauren Westafer and Dr. Oscar Martinez. Dr. Lauren Westafer is an assistant professor in the Department of Emergency Medicine at the University of Massachusetts Medical School, Baystate, and director of the Emergency Medicine Research Fellowship. She is an implementation science and pulmonary embolism researcher. She has expertise in dissemination of clinical knowledge and research and is co-host of the medical podcast Foamcast. Dr. Westafer also worked with other experts at UMMS Baystate to create the COVID-19 vaccine in pregnancy decision aid. We will include the link in the Q&A. Dr. Oscar Martinez is a board-certified obstetrician and gynecologist who has been at Baystate since 2008. He completed his residency at Baystate Medical Center in 2012 and joined Baystate Mary Lane Obstetrics and Gynecology in Ware, where he is currently the medical director. He also is an assistant professor of obstetrics and gynecology at UMass Baystate Medical Center. Dr. Westafer and Dr. Martinez, I am now happy to turn the program over to you at this time.
Thank you so much. All right. I thought just to get started, we would talk a little bit about coronavirus in general and then coronavirus, the vaccine, before we go into pregnancy-specific topics. And so, first of all, coronaviruses, they're not new. In fact, most of us who are adults have probably been infected with one, if not more, coronaviruses. Historically, they've presented as colds, but as we know from history, some forms of coronaviruses can make people quite ill. For example, there was the original SARS outbreak, there was the Middle Eastern respiratory virus outbreak several years ago, and now we have SARS-CoV-2, which is one of the more serious types of coronaviruses. Not serious in everybody, but when spread on a large scale, can be very serious in vulnerable populations. And by now, we sort of know that the virus is very easily transmitted and can come in waves. So we were familiar with the first wave. So you can see a spike in Massachusetts specific cases back in April and May of last year. And then we can see that things got better for a long time and we had very few cases. And then the holidays came, we had November and December, and we really had a surge in cases here. Now, if it were just any old cold, we probably wouldn't be having this talk. The problem is that there have been a lot of hospitalizations as a result, because some people, not everyone, but some people get really, really ill. So we've learned how to manage patients as outpatients, and overall, the hospitalization trend is getting better. But as even the most recent December, January, February, March time period showed, our hospitals can be overcrowded as a result of coronavirus. So here you can see two peaks representing when our hospitals have really been hit hard by the number of patients who are suffering with bad COVID-19. And unfortunately, some subset of people are killed by this virus and end up dying as a result. So a lot back in March, April, and May of last year, but again, a peak mirroring the number of cases in the state, showing that people are still dying of COVID-19. Thankfully, not as many, but still, the hope is that couldn't some of this be preventable? Now, if it were just hospitalizations and death, and you were in a low risk group, so maybe you don't have hypertension or high blood pressure, maybe you're not older, there are still some issues that make you may not want to get COVID. In fact, not want to get COVID. Some people suffer from post-COVID syndrome, where they have mental fogginess, dizziness, persistent shortness of breath, where they just have trouble breathing because they have persistent lung damage. You can damage the heart and the kidneys. You can not be able to taste or smell your food, which just sounds awful to me, and trouble sleeping and trouble with mood as well. So it's not just hospitalization and death, although that's the really bad part, but there are other reasons that you might not want to get COVID too. Now, enter vaccines. So now we have some vaccines for COVID-19, and it's been just over a year. And you may be thinking, like I think many of us were initially when we heard that vaccines were here, was that seems awfully quick. Wasn't this a little bit rushed? But typically, if you look at the bottom arrow here, is you have research and then you have some development and then you test it and then you go through this approval process. And then after it's approved and you finally get that clearance, you go and you develop it on a mass scale and then you get it out there. Now, none of those steps were skipped in the development of the COVID vaccines. Actually, all of those same boxes were just checked. But what happened was teams worked together. So the government partnered and invested with some groups to help support them. And what we also saw happen is when people got a promising candidate, they would test it and start producing quantities at the same time in hopes that it would work out or they would find the right dose. But processes that often happen one after another happened sort of all at the same time before the approval process. And so they had the delivery set up before we had even got approval, just so things were ready to go if it was found to be safe and if it was found to be effective. And so currently, there are 3 vaccines that have emergency use authorization. The Pfizer and the Moderna are the ones currently being administered in the United States, and the ones we're going to talk about now. And part of that is because the Johnson & Johnson vaccine, currently the FDA and the CDC have recommended a pause on this while they sort out some information on some very, 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 very rare side effects that have been picked up because what's happening is they're really looking to see, is there anything else going on? Making sure that these are as safe as possible. And so, like I said, none of these steps were skipped. So the vaccines were tested, and before any of them were administered, every vaccine was tested in more than 15,000 people, and they were tested against salt water. So 15,000 or so people would get the vaccine, and 15,000 or so would get a saltwater injection. So they all got tested in lots and lots of people. About what often the number of people vaccines get tested in. The reason this was able to happen so quickly is because we had so much COVID in the community, we were able to detect the disease much earlier than, say, if it was a vaccine to prevent something like cervical cancer or something like that, that often takes much longer to pick up. Now, it was tested in more than 15,000 people, but now we have even more data because the CDC and organizations like the CDC in other countries have been really looking and asking people about the information. So we'll talk about it later, but after you get the shot, they'll ask you to participate in a program called vSafe, where you can contribute and mark your symptoms every day. In fact, I got my spouse got a text message the other day to complete their information about have they had any symptoms after the vaccine. And so we have data on what happens because millions and millions of people have already been given all of these vaccines, well, into the several million people range. And then on all those millions of people, the CDC and the FDA are meeting regularly to discuss, well, it's still safe even in these millions and millions of people. And thus far, in millions and millions and millions of people, the Moderna and the Pfizer vaccines have been found to be very, very, very safe. Now, there are some side effects. So one common worry is, well, what's going to happen after the vaccine? And almost all side effects from any vaccine happen in the first 6 weeks after you get them. With the COVID-19 vaccine, what they found is that right after the vaccine is your arm will hurt because the medication, the vaccine, it doesn't go into your whole body. It goes and it gets to work in those cells right in the arm. So you may get some pain, you may get some redness there right where you get the shot, because that's a sign that your muscles are really at work creating those antibodies, that the cells are really producing that immune response that you want. Now, sometimes you can get some other symptoms. You can get headache, you can get some chills, you can get some nausea. Very few people get fever, more people get chills. And so what can happen is, sometimes you might feel a little sick. But what's interesting and kind of funny is that when they've looked at this same thing in the saltwater group, is a lot of times for like headache and fatigue, the same number of people had these side effects in the saltwater group as in the vaccine group. So at baseline, a lot of us have headaches and fatigue. Now, Dr. Martinez, I believe, is going to take over at this point and talk with y'all a little bit about herd immunity.
Hi, good evening. I'm Dr. Martinez. Thank you for joining us on our conversation about COVID-19 vaccinations this evening. So why do we even need a vaccine? And I think it's so that hopefully we can end this pandemic by reaching herd immunity. Herd immunity is when a substantial proportion of the population is vaccinated with the goal of lowering the overall amount of virus spread in the whole population. For example, herd immunity against measles requires that 95% of the population be immunized. To reach herd immunity for polio, it requires a threshold of about 80%. For COVID-19, that threshold is between 75 to 80%. Maybe now they're talking about the possibility of reaching herd immunity once children are vaccinated as well. But regardless, I think in order to sort of see an end to the pandemic, it's vital that we all understand why it's so important to get the vaccination. Next slide, please. So why get vaccinated if I can just get immunity naturally? So infection leads to more death and hospitalization. 4.5 million people will need to die to get herd immunity by natural infection, and that's just not acceptable. So gaining immunity naturally is not the way to go. Next slide. What about COVID-19 vaccines in pregnancy? So a lot of my patients ask me, so should I get the vaccine? My obstetric patients ask me, should I get the vaccine? And so It's important that people realize that, yes, pregnant patients were not included in vaccine trials. Most pregnant people are never included in any type of medication or vaccine trial. But we do have some data that suggests that vaccination during pregnancy is safe. And that's data collected through the Baystate, which Dr. Westafar had mentioned earlier. Next slide, please. So it's important to, when deciding to get the vaccination, is to weigh the benefits of the vaccine versus the risk. And so the potential risks of getting COVID-19 in pregnancy can be pretty severe. Next slide, please. Harms of COVID-19 in pregnancy. So more likely to have difficulty breathing. A lot of what we know is that more than likely pregnant patients may not get severe disease, but there is a subset of patients with certain underlying health conditions that will probably get severe disease, and that includes patients with underlying health conditions such as diabetes, obesity, increasing age, cardiovascular disease. And in that diabetes subgroup, it also includes gestational diabetes, which is diabetes that develops in pregnancy. And there's also an increased risk for certain racial and ethnic populations as well. Next slide, please. The normal respiratory physiology of pregnancy. So normally you are in pregnancy, you feel a little bit more out of breath. And that's because the chest size increases, the diaphragm pushes upward because of the growing uterus. So there's a decrease in oxygen in the lungs. So with the COVID, and that's just normal physiology, and then add a COVID pneumonia to the picture, which makes it even harder to breathe. And thus there's an increased risk that someone who gets severe illness in pregnancy with a COVID-19 infection will require a breathing machine. And interestingly, pregnant women ages 35 to 44 with COVID-19 were 4 times more likely to need a mechanical ventilation, so a breathing machine, and twice as likely to die as their non-pregnant counterparts. Also, next slide, please. And so all these, the burden of a COVID-19 infection, such as having to be on a ventilator or developing severe preeclampsia with a COVID-19 infection, it all increases the risk of preterm delivery. So, I guess, the take-home message when I mentioned earlier, the risks of the vaccine versus the benefit, to me, the benefit greatly outweighs the risk. So getting the vaccine, because regardless if you're not in that group where you may get severe illness in pregnancy, we just never know for sure. And we know that, given data collected after people started getting vaccinated that included pregnant patients, we know that it has been safe in pregnancy. So, I think that's a take-home message from these slides, is that, the benefit definitely outweighs the risk.
Now, I'm going to talk a little bit about those risks. And part of the reason I'm going to talk about this, I'm an emergency doctor, and yes, I'm also a researcher, But part of my role in this is also I had to decide and make this decision because right when the vaccines came out, as an ER doctor, I was super excited because I was high risk and I didn't want to come down with COVID-19 or expose my family. But I also found out that I was 5 weeks pregnant right when the vaccine was coming to market. And so I did a lot of the research and found this out. And I'm really excited to share a lot of this with you today because a large paper was just published last night, giving us a little more information, showing us that we do have this safety. So now we have data on over 86,000 people who have received the vaccine and said that they were pregnant. So over 86,000 people. That's a lot of people who have been pregnant and received the vaccine. And what I wanted to know, first of all, is do the side effects in pregnancy, are they about the same as they are in non-pregnant people? And I'm sorry. So people aren't getting more sick. They're not getting more fevers or things like that. But the other thing that I had to think about was, are vaccines in general safe in pregnancy? And yes, they are. But I'd like to know a little bit more about that because we know that a lot of vaccines are safe in pregnancy. And pregnancy in general, you get the Tdap vaccine, the tetanus vaccine, and you also get the flu vaccine in pregnancy. And so we also know that there are no ingredients that are thought to be harmful. Now, there's also the thought about fever. Very few people will get fever who get the vaccines. 1 in 100 will get a high or serious fever. But fever in general, there have been studies showing that maybe it makes things a little bit worse in pregnancy, maybe it doesn't. But in people who are taking a prenatal vitamin or folate, the thought is that there's very little side effect and that those harms aren't there. But also, if you get a fever, you take Tylenol, which is safe in pregnancy. And so it's really a moot point. So when I was making this decision, I thought about this and I was worried about it, but then I was like, oh yeah, in my rational brain, I can take Tylenol. And my doctors agreed, like, yes, if you get a fever, take Tylenol. That's what we'd advise you to do, even if you got a fever in the absence of the vaccine. Now, the other thing to think about is I was worried about, well, what about the pregnancy? It's not just about me. I want to know, what about the risk of pregnancy loss? Because I was in the first trimester and that's when most happen. What happened is, so far, of the people that they've been following closely for these, 827 have had completed pregnancies, have reported having a completed pregnancy. They followed up with the V-Safe program. And most of those resulted in live births. So they were fine. Everything was fine. Now, that means that some didn't, which is something we don't like to think about or talk about because it makes us nervous, but it's normal. We know that in general, pregnancy loss is common. So it was overall 13.9% in those who received a vaccine. So most of these occurred in the first trimester. So it's called a miscarriage is how people tend to call it. But we know that often happens, 10 to 25% without if you didn't get a vaccine, your chance is like 10 to 25% of that pregnancy resulting in pregnancy loss or a miscarriage. We don't like to talk about that. We had it, but it's common. So there's no signal here that you have an increased risk of miscarriage or pregnancy loss if you get the vaccine. And this was with a lot of pregnancies. Now, there's also preterm birth. So, you worry about that. He spoke about that. That's a risk of COVID-19. Is it a risk with the vaccine? Maybe if you get some of those chills or fevers, this would result in preterm birth. But it hasn't. It occurred in about the same number of people as occurs in the absence of the vaccine. So this reassured me as well when they're studying lots and lots of people, and lots of people have already, completed their pregnancies, that people weren't giving birth early, even if they got their vaccine in the second or third trimester. The other thing that we worry about is obviously that fetal development, the development of the baby. We don't want to do anything that would hurt that or harm that. And we also know that at baseline, about 4% or so of pregnancies will have some sort of congenital defect, or often called a birth defect. It's a congenital anomaly. So whether it's a cleft palate or a hole in the heart or something like that, these happen and these are common and we don't have anything to blame usually for them. Now, what happened is this number is actually outdated because, like I mentioned, that paper came out late last night. It was 2.2% who received a vaccine in the 827 completed pregnancies, which is about where the baseline of 3% of those who don't get a vaccine. So your risk of a congenital abnormality doesn't appear to be increased by getting a vaccine. So overall, when I looked at this data, and even now as I look at it, my thought as a pregnant person, but also a researcher and a doctor, was I am very reassured by this data and that they're following up people so closely. And I'll let Dr. Martinez take away from here.
So what do we know about the vaccine in pregnancy? So we know now that antibodies against the virus have been found in blood of babies of vaccinated individuals. Thus, the vaccine does not just protect a pregnant person, but can also protect the baby. Next slide. We know that the vaccine appears to be safe, effective, and the decision to get the vaccine obviously is your own. Some of my patients want me to make the decision for them, and I just have a conversation and weigh the pros and cons for them. Mostly, like if they have comorbidities, then I highly recommend they get the vaccine at any trimester. We discuss what we know, and unfortunately, yes, the data is growing every day. We have new data, new information, and it all seems to suggest that the vaccine is safe in pregnant patients. Next slide.
Now, if we've left you a little bit wanting in terms of recommendations here, a group of people who are experts, so maternal fetal medicine doctors, OBGYNs, and then some of us who are experts in research and risk communication, came together and came up with a decision aid to kind of help you guide through and think about what is your risk? What is your risk of getting COVID? Maybe you don't have any risk factors and you could stay home. Thinking about, well, what is COVID like in pregnancy? Because some of the things that, you may get a fever in pregnancy with COVID, and you're not very likely to get one with the vaccine. But also, what do we know, honestly, about the vaccine in pregnancy, which is more and more every day? And what do we not know at this time? And what are the side effects? So we created this. It's a couple pages long. It's available online in several languages. This updated version is currently being translated. The information is still accurate if you visualize it in a different way in one of the other languages. And then, we go through what do the experts recommend? Because I know as a pregnant person, that's what I was scared of, and that's what I turned to try to help you make that decision for yourself. So this is available on the internet. There's also a link to it in the chat as well if you are looking for it.
So what do we know about the vaccine and lactation? So we know that multiple studies have shown that there are antibodies in a vaccinated mother's milk. How exactly these antibodies protect the infant from COVID is not super clear, but there's ongoing research, ongoing studies. And there was one small study that came out of Israel, and it seemed to suggest that antibodies in breast milk were neutralizing, meaning that the breast milk had the capacity to prevent the dissemination of the virus and the ability of the virus to infect the whole cells. So that's very good news, but it's still ongoing research. In terms of the safety of the vaccine in breast milk, we do know that Pfizer and Moderna were made using mRNA molecules, and we do know that these mRNA molecules have a short half-life, short lifetime, and thus are very unstable, meaning that if they were in breast milk, they won't survive, and thus they won't affect the baby getting the breast milk. In regards to how long might the protection last, say in somebody who is breastfeeding, how long will the protection last in their baby? Probably as long as she's breastfeeding the baby, or they're breastfeeding the baby. It's a protection called passive protection. So meaning that as soon as you stop breastfeeding, then the protection stops, because it's not an actual vaccine that the baby's getting, they're getting the antibodies. It's also important to keep in mind that it took about 2 weeks after the first shot for antibodies to show up in milk, and then they peaked after the second shot. So the take-home message on lactation and the vaccine is that vaccinated breast milk is safe and likely helping protect the baby from infection. Next slide. What do we know about the vaccine and fertility? I get this question a lot in the office. Patients are concerned. So I will say that there was a myth going around saying that the vaccine caused infertility by generating antibodies that not only targeted the coronavirus spike protein, but also a protein in the placenta called syncytin-1. And that's completely false. So there have been no evidence reports of infertility among women who have recovered from COVID-19, despite millions infected. Women got pregnant after getting a coronavirus infection and vaccination. And so the rumors going around saying that the vaccine causes infertility are not true. Next slide. What do we know about the vaccine and fertility again? So current recommendation is not to delay conception. If you are undergoing fertility treatment, obviously have a discussion with your physician. And the recommendation by the American Society of Reproductive Medicine was simply to wait, so not have a procedure done 3 days prior to the, not have a procedure done 3 days prior, 3 days after getting a vaccination. Next slide. And so how do we report side effects? So Dr. Westafar talked about the V-Safe. It is requires you to have a smartphone, and you can log on to vsafe.cdc.gov. Basically, you sign in, you sign up. There's some information they're going to ask you from the card you get when you're vaccinated, and then they'll send you a text. Initially, I believe it's every few days, and eventually it's every week, and so forth and so forth. And this helps collect data. They just ask you, it's very quick. They ask you very simple questions like, how are you feeling today? Any side effects? Have you had to stay home from work? Things like that. And it just helps collect more data so that we can have more information on the vaccines. Next slide. How do I get the vaccine? So you can go to vaxfinder.mass.gov. Currently, if you are over the age of 16 and live, work, study in Massachusetts, you can get vaccinated. And so this website will help you find where you can get the vaccine, so you can sign up and get it. Next slide. So when am I fully vaccinated? So with the Pfizer vaccine, it requires 2 doses, 21 days apart. The Moderna vaccine requires 2 doses as well, 28 days apart. And currently, the Johnson & Johnson vaccine is either 1 or 2 dosages, mostly 1. And currently, there is a pause on the vaccines, on the Johnson & Johnson vaccine. And hopefully, we have an answer very soon as to making, a statement saying that it is safe.
So just to bring it home here, these vaccines in non-pregnant people have been proven to be safe. And the data is still coming in, and obviously humans, the pregnancy for a human is 40 weeks. It's a long time. So we're still getting more and more data as these it's now 90 as of the 96,000 pregnant people have had the vaccine, one of the COVID-19 vaccines. So as we get more data, but even now we have a good amount of data, especially if you're looking for like pregnancy literature, because there's not a lot of data on things in pregnancy. And it all appears reassuring and safe. So in general, even after you get the vaccine, when you're out and about with people who are vaccinated, the recommendation is still to wear a mask, socially distance. There is a small chance you still could get COVID because there are other factors going on. It's not 100%, it's very close, it's very good. But even if you were to get COVID and have vaccinated and be vaccinated, your chance of having a serious outcome is much, much, much less. So in general, the vaccine looks safe, looks good, and that includes in pregnant people. So I think now we are done with our portion of the presentation, and I think now we're ready to turn it over.
Sure, Dr. Westifer, could you just pull up that last slide? So just a reminder that the vaccine is free. And these are just a few other frequently asked questions here. And then the next slide, please. We invite you to visit baystatehealth.org/bestshot to hear more personal vaccine stories from some of our healthcare providers and others, and also to continue to learn about why the vaccines are our best shot against COVID and how you can prepare to get the vaccine when it is your turn. So thank you. So thank you again, Dr. Westifer and Dr. Martinez, for your informative presentation. We have now reached the Q&A portion of our program. For those again joining us by Zoom, please look to the bottom middle of your screen where you will see the Q&A icon. Please submit your question via the Q&A icon. I will read the first name of the person and their question. If you would like to remain anonymous, you may do so by checking anonymous when submitting your question. We've also incorporated a few questions that were submitted in advance of tonight's event. And I will read the questions and pose them to Dr. Westifer and Dr. Martinez, and they will answer your questions to the best of their ability. So I'm going to kick us off with our first question. The first question is anonymous. I am scheduled for my vaccine this weekend, but there is a small chance I could be pregnant. Should I go ahead and get the vaccine anyway? I am concerned about getting a vaccine that hasn't been studied in pregnant women, yet I am also concerned about getting COVID while pregnant. I am fairly low risk since I am a stay-at-home mom with a toddler and we only do outdoor social activities, but my vaccinated husband does have a very high-risk job. If I am pregnant, would it be better to wait until second trimester, or would it be better to be vaccinated sooner? Thank you so much. So who would like to try to address that question?
I can start to answer the question.
Thank you.
So again, it's always a discussion and weighing, comorbidities and risks to you. I think though that there is no specific real trimester where, we say you should wait to the second trimester, wait to the third trimester. I think that if you are able to get the vaccine, I would get the vaccine. I think, we have data that says it's safe. And to be honest, like we said, sometimes with COVID and severe illness, that can be even worse and than a potential side effect. The biggest side effect really in first trimester from the vaccine to watch out for is fever. So if you were to get a high fever, sometimes that can cause lead to anomalies in the developing fetus. But you can treat that with Tylenol, which is safe. So that is the recommendation. So mostly that, that would be what I would recommend to you. So yes, I would get the vaccine if you develop the fever, because it sometimes can happen. Tylenol is safe to take for a fever or for other side effects from the vaccine.
And just to weigh in here quickly as well, having gone through this decision, for me, one thing that played a role in my decision to go ahead at about 6 weeks pregnant to get the vaccine was knowing that I had about a 15% chance of having a miscarriage or pregnancy loss, and trying to make sure that I wouldn't blame myself, and that I not that I could live with that, because it would obviously be very disappointing. We were undergoing fertility treatment. So we very much wanted that pregnancy, but we just had to have that rational side of our brain, my partner and I, to recognize that if something happened, it wouldn't be fair to blame the vaccine and ourselves, and to sort of have that contract going in that we have data that shows that it doesn't really increase the risk of those things. So for me, that was important for me. For some people, they probably can't. They would blame themselves. And so that's just another sort of medical, non-data driven thing to weigh in as well when you're making your decision.
Great, thank you both. The next question I have, it doesn't appear to be pregnancy specific, but I still think it's a worthwhile question, so I'm going to pose it. If you tested positive on March 17th, is it safe to get the vaccine now? Why was the initial recommendation 90 days? Is there a chance that your body will have a more intense reaction in a person who recently had COVID, or was the 90 days a suggestion because of limited vaccine supply? I also had COVID pneumonia and fever for 6 days, so I want to make sure it's okay to get my vaccine now. Also, if a person has a slight cough, is it okay to be vaccinated? Thank you.
So I think that this is a great question, because I think one of the questions is, I had COVID, do I even need the vaccine? And the answer is really yes, because the variants that you may have heard about, so strains of parts of SARS, the virus that causes COVID, can change rapidly, and the vaccines work pretty well against those. But it turns out natural immunity, so if you just have the infection, doesn't work as well for those types of things. So if there's something circulating in the community, you could get it again without the vaccine. Now, the initial 90-day recommendation was just because nobody gets reinfected in that first 90 days. So you are safe, allow your body to recover. But also, I'd be lying if I said it wasn't also a supply thing as well. So I think some of those recommendations do come there. For me personally, we don't have a lot of data to say. So at this point, exactly 27 days or 45 days, this is when it's best. So again, as a researcher, I want to tell you when we do know things and when we don't know things so much. So this is one of those things, we don't know exactly when you should get it. We know you should get it. For me, I'd probably wait till I was totally feeling better. If you still got a little bit of cough or something, I would clear it with my doctor first. Otherwise, I would make an appointment for somewhere around that 2 to 3 month mark. So because I would know that I'd allow my body to recover, and I also would be fairly well protected during that time. So that's personally what I would probably do. I would get it, make sure that I was scheduled and going to get it. I think if you got it now, it'd be okay. If you got it in a month, it would also be okay.
Thank you, Dr. Westover. Dr. Martinez, maybe this might be a good question for you. I am waiting for my second trimester to get vaccinated. Any input about that? Does it make sense to wait? I'm currently week 8.
Again, we have to weigh if there's any underlying health conditions or any high risk of exposure. But in all honesty, I think I personally wouldn't recommend waiting. If possible to get the vaccine now, you should get the vaccine at this point. And especially if you have underlying health conditions. So those were like diabetes, obesity, history of smoking, history of hypertension. Those patients tend to get severe illness, which can lead to further complications. So, so I wouldn't really recommend waiting if you have the possibility of getting it now.
Thank you. Our next question is anonymous. Is the vaccine safe for women who are breastfeeding?
Yes. So we do know that the vaccines, specifically Moderna, Pfizer, are made using mRNA molecules, and mRNA molecules seem to not, are not very stable, meaning they dissolve quickly, so they should not cross over into breast milk. And if, for instance, they did and were digested by the baby, which is a very low chance that would happen, then the digestive enzymes will break down the mRNA. There are benefits to breastfeeding once you've gotten vaccinated, specifically that you pass antibodies to the baby. So as long as you're breastfeeding, the baby is getting antibodies, and that's probably protecting the baby from infection. And so yes, there is definitely benefits to breastfeeding and benefits to getting the vaccine while breastfeeding, and it is safe.
Thank you. The next question is anonymous. Do you need your insurance card to get the vaccine?
So I think that depends on where you go. Oftentimes people will take that information down. To be honest, I know it's free. I don't know whether you have to have that, because whether you are insured or not, you can still get the vaccine.
Thank you. Our next question is also anonymous. Does using Tylenol to decrease a fever while pregnant definitely decrease the risk of birth defects? If I were to have the vaccine in the first trimester, but then take Tylenol, is that risk totally mitigated?
So I can start answering too, and Lauren, if you have any other things to add. But nothing is 100% can say, oh, it's totally mitigated. I mean, that's we can't really say it totally mitigates the risk, because just in general, there's a risk of a congenital anomaly happening if you didn't get the vaccine. So I guess the take-home message is, again, weighing what your risk exposure is, and comorbidities like diabetes, obesity, smoking, hypertension. And if you're in that high risk group, then the risk of a congenital anomaly wouldn't outweigh for me the benefit of getting the vaccine. So sometimes you have to weigh risks and benefits, because you can get very sick, especially if you have those comorbidities, and that can lead to other complications. So unfortunately, I can't say, well, it completely mitigates the risk, but I can tell you that if you're in the high risk group, then the risk of getting COVID is probably greater, and so that's why I would say I would still get the vaccine.
The other thing I would add is that the studies that look at fever in pregnancy and show defects like spinal cord defects and things like that, problems with that, they're all over the place. Some of them show an association, some of them don't. But in pregnancy, we worry about everything so much. So we err on that side of worrying about it, rather than, looking at the studies where, maybe there is a problem with it. But also in the United States, we tell people who are pregnant or contemplating becoming pregnant, or as soon as you find out you're pregnant, to take a prenatal vitamin, because it has an important supplement in it, of folic acid, which helps prevent those. And they found that in people who are pregnant and have a fever and take those, which we should be taking anyways in sort of the pre-pregnant and pregnant phase, that there's not that association there. So like Dr. Martinez says, the risk is never going to be 0%. It is never, it's whether there's a vaccine or not, we just can't do that. The best that we can do is somewhere around 3 to 4% risk. So 3 to 4 out of 100 pregnancies will have some sort of defect, which is, again, something we don't really talk about as a society, but that's the bottom line, real world risk. And we can't really do better than that. And so it's not like getting the vaccine is protective against that. There's still that risk there, but it'd be their vaccine or not.
Thank you. Our next question is anonymous. Out of 800 pregnant women, you said things turned out fine. How many were in total and how many had complications?
So in the study that was published, it was actually in over 35,000 pregnancies. But of those, they look at a much more detailed portion. So about 5,000 have been enrolled so far that the CDC actually calls and gets records from your OBGYN. They called me last week to get more information to check in, see how things are going. And so of those, 827 have had a completed pregnancy. So either they have given live birth, which is most of them, or not. And so, like I said, 86.1% had a live birth. The others did not. That 13.9%. And most of those were miscarriages in the first trimester, 12.6%. And that is what you would expect at baseline. Now, of all of those 35,000 people, 221 people reported some sort of adverse event. And most of those were fatigue, headaches, chills, pain in the extremity. So the side effects that we talked about that you'd get pregnant or not, that are not dangerous to a pregnancy. They may be a little inconvenient because when you're pregnant, generally you're fatigued anyways. And so you don't have that reserve to spare, but they're not dangerous. There were only 66 out of those 827. So very few that were pregnancy specific. And almost all of them we talked about were the miscarriages or the pregnancy loss. There were very few other adverse events from that.
Thank you. Our next question is anonymous. It may have been answered a little bit previously, but just going to lift it up again in case there's anything you want to add. The question is, I'm afraid that the vaccine could lead to birth defects. Does it make sense to wait for second trimester since I am able to mostly isolate?
Yeah. So yeah, it's normal to feel, fears and anxieties, but like I said before, it's always weighing the risks, risk of exposure, the comorbidities. If you were completely isolated by yourself and no chance of infection, then, if you feel comfortable waiting to the second trimester, that's fine. But the reality is a lot of people can't do that. So if your risk is high and you have comorbidities like smoking, diabetes, gestational diabetes, obesity, high blood pressure, then I would probably get the vaccine at this time. And because again, disease, especially if you're in a high-risk group, infection with COVID-19 can have some serious complications.
Thank you. All right, we have 2 remaining questions in the queue, so I'm going to say these will be our final 2 questions. The next question is anonymous. My spouse is vaccinated but has a high-risk job. I have a sense of security because I can isolate very well and he is vaccinated, but do you think there is still a risk of him passing it to me even though he has had the vaccine? I know they are still studying whether vaccinated people can transmit the virus. Thank you.
Sure. This is, I think, a question everyone is really interested in. And this is exactly why so many of us in the medical community and in general want the vaccine, is because if everyone else were vaccinated, pregnant people wouldn't have to make this choice. If we were all protected, this wouldn't be on us. We could live off of that idea of herd immunity. So, it'd be nice if this weren't even a question for us. But, I think here we don't know for sure. The thought is that you don't transmit the virus, or you transmit it very inefficiently if you're vaccinated. It's just so many steps that when they've done things like given monkeys the virus through their nose and actually down into their lungs, and then checked a couple days after the vaccine, and they found they couldn't find it. But that does, and they've studied it also later in thousands of healthcare workers to kind of see. But these studies all have limitations. They're not perfect. We've got studies ongoing on this. We don't know a true answer yet. But the odds are that it's unlikely that person who's vaccinated will be able to transmit it. But again, I'm humble enough to know that there are limits to what we know in research and medicine. And so I can't answer that conclusively.
Thank you. Our next question is from Lauren. What is the difference between Moderna and Pfizer vaccine, and does it matter if you get the second vaccine 3 weeks before due date?
Well, I will take the first part of that and I will defer to Dr. Martinez for the second portion of that question. So the Moderna and the Pfizer vaccine are almost the same, except for they're made by two different people, and one you get 3 weeks apart and one you get 4 weeks apart. So they basically do the same thing. They take a piece of the virus, just a tiny little piece that isn't like actually from the virus. It can't go in your body and replicate, and it packages it in fat essentially so it can get into the cells. Because like Dr. Martinez said, the reason that this technology hasn't really been used before is it breaks down. Your body is full of mRNA. It's full of this mRNA. So if you were to get COVID, your body would actually be making the spike protein, the virus, using your own mRNA in your cell. So it's not like it's a new technology. So I probably shouldn't have phrased it that way because it's how the virus works regardless. But basically, it breaks down so quickly that we had to figure out how do you get it into cells and how do you make it last long enough. So they package it in fat to do it. So the basic difference between Moderna and Pfizer is they use different fat packing technology. That's the sort of best way to explain it. And there are subtle differences between them, like storage temperatures and things like that. A lot of it's because it's just how they tested it. Pfizer didn't go through a lot of this stuff and say, okay, we need exactly this temperature. They said, well, we know it works if you keep it super, super cold. Whereas Moderna fiddled with that, first of all, a little bit more. So they're very, very similar. Dr. Martinez, I'll let you take the second portion of this question.
Yeah, I think it makes perfect sense to get the second vaccine 2 weeks before the due date, because 2 weeks after you get the second vaccine, you're considered to be fully vaccinated. So going into the hospital for your delivery, you already have that full protection. So I think absolutely, yes, you should get the second vaccine, and it does make a difference.
Great. So to our presenters, we actually have 2 more questions. Are you open to answering them? You good? Okay. We actually received one from Facebook that Brendan shared in the chat. The question is, I am 2 weeks postpartum, so I've received conflicting information from 3 lactation consultants as to when it is okay to get the vaccine timing-wise. I also had a C-section, so I was waiting a little while to heal and get cleared at the 4 weeks postpartum checkup as I was considering side effects from the vaccine. Any thoughts on appropriate timing or things to consider?
Yeah, so, I keep repeating this, but it depends a lot on your risk of exposure and comorbidity. So if you're in a high risk of diabetes, gestational diabetes, obesity, smoking, hypertension, it makes sense to get the vaccine now. I think, we recommend waiting, or not getting the vaccine 3 days prior to a procedure or 3 days after, just because sometimes it would be hard to differentiate, say, if you got a fever because you have an infection from your fever or procedure versus a fever from the vaccine. So I think at this point, you're 2 weeks postpartum. If you feel like you're improving, you're doing fine, you're healing, then I would say that, you can at least start the process to sign up and get vaccinated, and so you can get an appointment. But I don't think there's any reason why, unless, there is some other complication that's ongoing, why it wouldn't be safe to get the vaccine at this point. Plus, if you're breastfeeding, you'll pass those antibodies on to the baby, which I think is a great benefit.
The only other thing to consider here, as someone who has been a breastfeeding parent in prior births, is just thinking about your supply and other things that kind of go into breastfeeding, especially after having a C-section and being postpartum in that early sort of milk production phase. Is hydrating to make sure that just in general you would be making enough milk, making sure that you don't drop a pump if you're tired or need some extra sleep. If you do happen to be, if you're a few weeks postpartum, you're probably pretty fatigued anyways, but just sort of making sure that you do the normal things that you should do to help keep up your supply to feed that baby that sometimes can easily slip through the cracks. So that's the only other thing I would weigh in on there. There's no doubt that it would dry up a supply or anything like that, but that's something that I know I always worried about with everything. And so I would just drink extra fluids and things like that.
Thank you. And our final question is from Karen. Does the vaccine affect fertility?
No. So I know there's, a lot of things out there that question this. And so initially, it's something that came about because of the spike protein, the coronavirus spike protein, and there's a placenta protein that's similar, and they thought that it would attack the same sites, but these are two different structures. And so, no, the vaccine does not affect fertility. Patients got pregnant during the vaccine trials. Patients have gotten pregnant after a COVID infection. So it does not affect fertility. No.
Great. Thank you so much, Dr. Westifer and Dr. Martinez, for your engaging and informative presentation. I'd like to thank all of our participants that have joined us this evening from Zoom to by phone, by Facebook, and YouTube for your interest and thoughtful questions tonight. We know that you may continue to have more questions after this evening and encourage you to visit our website, www.baystatehealth.org/bestshot, to continue to learn more. At Baystate Health, we're committed to providing comprehensive care and delivering on our promise of advancing care and enhancing lives to all of those we are privileged to serve. We invite you to join us next Wednesday, April 28th at 5 p.m. for our third and final town hall. This will be a general COVID vaccine town hall that will be held in English. And I'd just like to, again, thank you again for being with us this evening and wish you a wonderful good night. Thank you.